Thank you so much for staying tuned with us here at the Government Information Service, National Television Network, GIS NTN Studios. I'm Lucia Joseph, back with you in the Information Command Center, and as always alongside me is Primus Hutchinson. And today we're speaking with representatives of the St. Lucia Fire Service, and we'll be having, as always, information that you can put to good use, not just during this COVID period, but specifically in this COVID period, but of course, information that you can apply to your lives moving forward. With me is the Fire Chief Fire Officer, Mr. Joseph, Station Officer Fernando James, and later on we'll be joined by Station Officer Arlene Rosary, as well as Assistant Divisional Officer Shane William. That's coming up. Chief, COVID-19 has presented some really challenging times for not just St. Lucia, but countries around the world. Organizations like yours, institutions like the St. Lucia Fire Service will be at the forefront of how our nation responds to this pandemic. For the St. Lucia Fire Service, give us some insight into how you've been able to manage, not just as far as resources in terms of deployment, but even as far as being able to deal with the sort of psychological impact that COVID-19 is having on the members of the fire service.
Okay, thank you, Lisa, and thanks for having us. Like every organization, the St. Lucia Fire Service had to make some adjustments to its operations. Although our profession is inherently filled with risks, but this one in particular was something that perhaps nobody had planned for. However, we are not strangers to hazardous conditions, and we had to make some adjustments and of course provide some new training as a result of the COVID-19. We have Mr. Fernando James, who has a list of some of the measures that we implemented, and I'll have him go through that. But as we go along, we will provide you with some more information.
Okay. Yes, I know that new protocols have been introduced in the response for COVID-19, but before we get to those protocols, yes, I know the Fire Chief spoke about some of the training sessions that you've done to prepare the members of the service in their response. So if you could give us an idea as to how much of that was done and how satisfied you are that they are now fully able to be functional in their response to COVID-19.
Yes, sir. Good afternoon, Lisa. Good afternoon, St. Lucia. As you are well known and well appreciate that the St. Lucia Fire Service is the lead transport agency for COVID-19 in terms of transporting and treating of any suspected or confirmed case, or even any unknown case for that matter. And of course, the Ministry of Health is directly responsible for its overall management. In relation to training, the fire department have always been involved in training and specialized training for that matter. And as a firefighter or as an emergency medical technician, we are frequently involved in all different types of training. So COVID-19 is not any different to that in terms of infectious disease. But moving forward with this type of disease and pandemic that has stricken the entire world, inclusive of St. Lucia, we have seen the need that we should have additional training in the area of infectious disease. So training for personal protective equipment, wear, decontamination, and even interrogating patients through 911 and how we transport and treat patients on our ambulance. The training had begun from very late last year and of course has continued throughout of this year. And again, training can sometimes change based on how we see trends develop within the COVID community in terms of the number of victims and how they progress. So we have done a lot of extensive training for all our fire stations, including the airports. We've looked at, first of all, when someone calls 911, the various questions that we will ask the caller, whether it be a patient or a family member or colleague. In addition to the nature of call or the location of call, there are questions we will ask pertaining to: do you have a fever or cough or shortness of breath, travel history, work history? And we want members of the public to be very patient in our lines of questioning. Anything that is not privy to us, we won't go down that lines, but anything relevant to patient care and also provider safety, we will interview and most times interrogate the caller to get the pertinent information so that we can keep you safe, keep members of the public safe, keep the firefighters safe, and of course to provide the relevant information to the receiving hospital as soon as we can transport that victim.
I am smiling because I had that personal experience just to be able to
Yes,
help members of the public fully understand. When I was critically ill and in calling of the fire service, so I really couldn't breathe. And the person on the other end, of course, very aware that I was really gasping for breath and trying to talk. And then the person said, perhaps do you have a travel history right away? But then I now had to have the awareness, but okay, so it's COVID, and yes, they're going to be concerned.
Yes,
and so even in that moment of fear that I had, because when you are short of breath, you're beginning to panic. And so I now had to bring myself to say, well, okay, this is what they're doing. They're trying to ascertain exactly what is happening.
Correct.
So you're right that when people will call and they are in a crisis of their own, that you perhaps will be irritated by what the individual on the other line is trying to do by ascertaining what is really wrong with you. So you're right, the patient, you need to have the patience and just be aware that they're trying to keep you safe as well as themselves safe. So I just wanted to bring that as a personal example as to yes, yes, they're following the protocol.
Yes.
And I think that's a critical point that we need to stress on. In terms of the information, presented or gathered during this call, because it's critical for us to have the right information when responding to calls, because we need to know exactly what preparations should be made before we respond. And if the wrong information is given, then perhaps you could have the wrong response, and it also puts our personnel at risk. And you can well imagine just putting firefighters at risk, and these persons, have to go back to the station, with the possibility of infecting their colleagues. And of course, it means that we would have to quarantine an entire station because of one, call where we...
that one response.
Right.
Yes.
Yeah.
Yes. Yes, Mr. James, sorry about
No problem. Additional training has also been done in the area of personal protective equipment. You may see us many times waving down the road in a siren, lights and siren with white suit. I think might be spacemen that are going down there. But this personal protective equipment allows for the type of infectious disease that we are being exposed to and that we are dealing with. So we've had training in how to don and doff, meaning to put on and take off. And these pieces of equipment in terms of goggles, gown, gloves, masks, are specifically for any infectious disease case. And I said, whether it be unknown, confirmed, or suspected. So all the members of the Essential Fire Service, all the firefighters who are also EMTs, would have been trained in its use. And when we get that call for a suspected case, the dispatcher, of course, would inform the personnel, and of course, they would respond with the appropriate ambulance, which we have now configured for COVID response. And also, we'll use those pieces of equipment during the relation of our call. In addition to that, any additional training was also done in the area of decontamination. So we have a special response team that would respond on the completion of the COVID response team. So after they bring the patient to the receiving facility, that would be the isolation respiratory clinic at Victoria Hospital. Then we have a special response team to decontaminate the ambulance and also decontaminate the members of the public. The members of the fire service who are the COVID response tactical team. So training was also done in decontamination using our hazardous materials training and using specialized equipment just to provide for the decontamination aspect of any COVID call. In relation to treatments, well, based on the patient's condition, certain measures to be taken in terms of providing any care if necessary. And of course, anything that has to be done for that patient, we will receive medical direction from the receiving hospital or the transferring medical facility in that regard. So again, training in the areas of dispatching, providing emergency care in the field, decontamination, all this has been covered over a period of a few months in relation to the COVID response, our response to COVID-19.
Okay, and it sounds like a lot of work that you've been able to achieve. And now with this new protocol, what is, when you say it's new, because from what you've gathered, what you've said, I can gather that a lot of preparation went into being able to have the fire officers operate at optimum. So what is different about these protocols?
Well, different in terms of addition. We have a dispatch center, so when you call 911, apart from the general question that we would have asked pertaining to that call, we would ask further questions related to COVID-19. So you may say you may have chest pain, and we'd like to find out if you have a fever, if you have a cough, is it a dry cough, do you have a sore throat, is there any shortness of breath, do you have any abdominal pain, is there any vomiting, diarrhea, do you have any work history or travel history, and any other questions related to our interrogation or interview. And it's basically to identify if this might be a suspected case. And we are treating all our patients when we get 911 calls as a suspected case until proven otherwise. So we will provide you with the best care available. We won't downgrade our care and say we won't transport you or treat you, but we need to gather as much information as we can. It's part of our assessment, patient assessment module, and of course, also our treatment module.
Okay, great. In terms of, I know people will want to know this, the ambulance fleet, have you divided this into saying, well, we're going to use 2 ambulance appliances for COVID responses and save the other? So how do you now begin to, in the response, is it all of the ambulance appliances being used at this for all calls, or since we can't discern necessarily what is COVID and what it isn't?
Okay, we have a fleet of ambulances. We have ambulances at all our stations, assigned to all our stations, and we have in some cases 2 assigned to a particular station. In these situations, we have a frontline ambulance, and then there's the second line. So we, at all our stations, we have the capacity to respond to COVID-related calls. So it's a question of you know, where the call is emanating from, and we are, you know, prepared to make that response. Besides, after the call is made, like Mr. Fernando said a little earlier, we have the decontamination process. So that is done fully. So it's not a question of, you know, the chance of contamination thereafter. We ensure that, you know, this, whatever ambulance we make that response with is fully decontaminated before we make another response with it. And the thing is, we more or less assist each other. The various stations more or less complement each other. So if, say, one station is overwhelmed, another one could always handle maybe a pending call.
Okay. Fernando, on the medical emergency response side of it, now that we perhaps get to know a little bit more about COVID, did you have to sort of outfit any of the ambulance appliances with any special equipment, additional equipment, in the event that someone may be going into a real crisis as you are responding? Is there anything additional that the fire service had to lay their hands on in order to make their response more effective?
Well, in addition to the personal protective equipment, which we have always had over the many years, it's just as that the influx of calls have occurred, and based on how sensitive and how infectious this disease is, the equipment and the supplies that we have used as personal protective equipment, we're now more using it in greater demand. In terms of our ambulances, we have configured a few in relation to the transport of such patients. In terms of equipment, additional equipment, no, we have not changed our equipment fleet in terms of the treatment is all the same basic equipment. There are certain equipment that may be needed for such critical patients, but this would be available at the isolation clinics. Again, any type of treatment that we perform for a confirmed case or suspected case will be directed by the medical physician who is receiving that patient. So all medical direction will be taken from the physician of the receiving hospital as to how we'll proceed in providing any specialized treatment for such a patient.
Okay, we're due for a break, but just before we go, I did at the top of the show ask about the sort of psychological support that the officers are receiving. And so we've had instances of people being transported to whether it be the quarantine facility, isolation facility. When the officers have to respond and when they return, I know you're debriefing. Is it a different type of debriefing that goes on now? How are you helping the officers cope?
Well, quite apart from the support being provided internally, there is a provision for the services of a counselor. And that's all part of the COVID response system. So once it's necessary, if it becomes necessary, then the services are available.
Okay, wonderful. We are going to take a short break. When we come back, we'll be continuing our discussion with the representatives of the St. Lucia Fire Service.
In an effort to ensure patient and first responder safety, the St. Lucia Fire Service has reviewed its patient transfer procedures, especially for patients with respiratory distress. Face masks will be provided. At no time during transportation should the face mask be removed. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
Cette lisi ka registre vermin corona ek I ka fait mouvement ek an chay vitesse tan chaque canef ka kouye pour vigilance publique la fait wolo parler en place publique kon bol en main base ti boutique changer distance sociale 6 pieds Rodyon à l'autre. I ka travail tan, si ou senti ko pa cordial, quarantine ko, pas en contact et puis l'autre, en cas où te toi pe exposé. Si on est couillé, free 11 ou ben n'importe clinique yo pou. Les pays a dimi à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant 7 heures. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauve vermine corona. Si nous tous servi jid la à toutes les.
Together let us win this war. St. Lucia be a soldier. Together we can beat this corona.
Welcome back. You're in the Information Command Center. And as I told you earlier, we were speaking with representatives of the St. Lucia Fire Service. I'm now joined by Assistant Divisional Officer Shane William. Thank you so much. Welcome. And yes, we're not playing the musical chairs, but you know, because again of COVID-19 and the numbers here, we're making sure that we stay safe while we still bring in the information to the public. So we'll be seeing a changeover of the interviewees. Mr. William, thank you so much and welcome. Before we had the break, Fernando James was speaking to the protocols that are now, or the additional protocols at this time. And the one aspect, of course, is almost what I refer to a triage on the telephone. So when people call in for that assistance, that they now need to answer a few questions before you can actually have that deployment. So talk to us about how you see and a sort of quick assessment of how this protocol has been working.
First of all, let me say good afternoon to you, Lisa, and good afternoon to members of the public. The protocol, to a large extent, has been working beautifully for us. However, there are instances where persons, for fear of being stigmatized, have basically refused to give certain pertinent pieces of information that we require in order to make the appropriate response. Now, what this does is it actually gives or provides the officers who are responding with little to no information as to what particular situation they are heading into. On arrival at most of those scenes, our officers tend to find themselves in great difficulty because once the persons have been assessed and the symptoms have been recognized, then by that time the officers would now have to go into a different mode of treatment. What that does in the long term or short term is that it delays the provision of care to those persons. So we generally try to gather as much information as possible from those persons before our response, so that once the response is made, it is the appropriate response.
Okay, so people must be as forthright as possible. So when you call in, just give them all of the information. Now, I just want to speak to my personal experience, just to perhaps just elaborate on this. My telephone number was taken, and I received a call back. Is that part of the protocol as well?
Yes,
so people will be having that sort of experience. What is the sort of partnership you're having with private ambulance providers on island? Is there a partnership happening there?
Well, so far we've been handling all calls from within. We do have the assistance of private EMTs, so they complement our ambulance team, but they are assigned to our department, so they work along with us. But we use our own resources and ambulances for COVID responses.
Okay.
Just to add a little to the point that was made a short while ago, we have a serious problem with PPE, and one of the issues coming out of not providing the right information is that we have informed our officers that anytime they are uncertain, I mean they need to cover themselves. So we do not want our officers making any responses that would put their health and safety at risk, and by extension the members of the public. So if the right information is given, we go with the appropriate PPE. If we can't get sufficient information, there might be cases where we go with maybe more than we require, and maybe when we really need these pieces of equipment,
then
we may not even
with another team, and the other team will perhaps be needing it.
Right,
yes.
and we may not even be able to make a response because, I mean, if we are out of PPE, then we have a serious problem.
And so the information is critical for the public to give and cooperate. So during this time, how has the fire service had to augment its operations, if at all, to be able to have full capacity to respond to COVID?
Okay, we've made a few adjustments to our operations. We have some services that were cut back to some extent. Like for example, our fire prevention unit at this time would not be doing training on some of the inspections that they normally carry out. In fact, some of our personnel serving in the various offices have been reassigned to operations to assist with some of these duties. We also made some adjustments to our shifts, because we want to limit the exposure, of our persons, especially when it comes to traveling on public buses and so on, where sometimes the social distancing is not entirely possible. So we've implemented a slight change to our shift where they are not required to come in as often as they used to. We've made quite a few adjustments, and we've made some adjustments in our stations in terms of some of the materials that we provide just for health and safety, and it's critical because we only have one fire department, and our staff complement is just over 300, and God forbid, one station were to be affected, we would have to close it. And it's just, remember, our operations continue. It's we are faced with COVID-19, but we are still required to respond to all other sorts of emergencies. So health and safety for sure is our number one priority. Mr. William?
I think you covered that in its totality. The operations aspect of the fire service welcomes the additional manpower, because we always need that boost. Fortunately for us, general operations as it pertains to the public have been scaled back, so we can receive those persons and continue our operations with minimal delays.
Okay, we are due for another break, but when we come back, we'll be discussing what everyone can now breathe a sigh of relief over the Babonneau fire station. We know that there was a sort of a red flag that was raised there with the possible COVID case there, but thankfully that is negative. And so we'll talk about incidents like these, cases like that, what it is that internally, what your response is, and in terms of how you keep everyone else safe and yet still have to function. So we'll be back with our conversation with the St. Lucia Fire Service in the Information Command Center.
With all that's happening around us, simple adjustments are necessary to keep us all safe. When calling 911, we may need a little more information to deploy the right personnel and protocols. You may be asked about your travel history, signs and symptoms, contact and movement history, and whether others in your household are exhibiting similar symptoms. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
We're back here with our conversation with the St. Lucia Fire Service. Before we went to break, posed a question about the Babonneau fire station. We did know that there was a suspected case, but that has proven to be negative. But when you're going through something like that, are you, of all the protocols put in place, yes, you may activate it, but the human element, that the fear, the sort of trepidation that the officers are experiencing, because you have a colleague who's in contact with you all day long, And so if that colleague is sick, then it means that you've been exposed. So how did the fire service respond to this particular incident?
Okay, well, it was rather an unfortunate situation, but of course we had to deal with it. And of course, because little is known about this particular virus, our officers were concerned about, one of our colleagues who came in and had some flu-like symptoms. And of course, because he had spent some time on the job, we were not sure whether there had been some level of exposure. So we did contact the health authorities who recommended that he be swabbed and be put in quarantine. And of course, while the officers who were on duty at the time expressed some concern, about having to go back home, because of course we speak of the vulnerable groups, the old persons, the children, and so on. And we too have families, and if there's any level of exposure, in some cases, persons are concerned about going home and exposing, the rest of the members or the remaining members of the family. So that was the concern. So they requested to just stay in at the fire station. As a result, pending the results of their colleague. And of course, that took some time because, of course, the results were a bit delayed, and it resulted in, the authorities recommending that the persons who were not certain as to what their position was, be taken over to quarantine as well. So, but fortunately, like I said, it turned out negative, and we were back to full operation.
Full operation.
Okay. I just want to add that protocols have been put in place at all our fire stations for persons entering. So we do have an entry point where temperature checks are done, questions are being asked of persons, and the officers themselves monitor each other. So if an officer coughs or sneezes or feels feverish, the officer would check upon them, do a temperature check, do vitals, and make sure that the officer is okay. So we do keep tabs on one another so that we know everyone is safe, because in our theater of operation, there are times that we cannot observe social distancing, so we just need to know that each and everyone is safe.
Okay, wonderful. But during this COVID time, we have a dry season.
Yes.
And so it means now that the bushfires, they're igniting, by nature, or sometimes you have people who are out there and they're burning their rubbish, the usual, people at home now. So people are cleaning, spring cleaning all the time.
Yes.
so how has that been a challenge for the fire service?
Mr. Williams will speak to the frequency of calls that we receive. But I guess traditionally that's a part of our culture in terms of clearing, during the dry season and so on. But whereas, it presents an opportunity for us to clear our property and so on. But it is also one of the most, dangerous times to do it. And that situation is compounded by, gusty conditions and what have you, and especially if it's being done in a residential area. The risk of spread is great. And you can imagine the level of damage, and risk to life and property from just, a small fire escaping. So at this time, we would not advise anybody to do any burning, because it's unlike, the rainy season where you could easily control a fire. When in dry conditions, if you do not have, and even in some cases where you do have a water supply, maybe a garden hose or something on standby, you can have a fire, and the embers of that fire, become airborne, and the start of fire, quite a few feet away. So it's really a situation where we discourage persons from burning at this time.
Okay, I just want to add to that point. Over the last probably 10 years or so, we have actively discouraged persons from burning during the dry season. And we know that hopefully in the rainy season it rains a lot, so burning would be almost impossible. But we generally discourage persons from burning during the dry season because of the challenges they pose. There's also the risk of, like Mr. Joseph said, of fire spread to property and to other vehicles, other items. So we generally discourage persons from burning. I just want to draw your attention to some statistics that we have. Just last year, and between last year and this year, around the same time last year, we had significantly fewer bushfires, and as compared to this period now. We directly attribute that to persons being at home and persons having not too much to do. So we have seen a almost 70% increase in the number of fires. Now, you made mention of the fires starting themselves. Those type of spontaneous fires, I think on average we have 2 or 3 of them per year, and they are usually in areas that we cannot reach. We are usually called out to those fires, and the nearest we could get to those fires are probably 2 to 3 miles. Okay, the significant number of our fires are deliberately set, and most of them are done for cleaning purposes. So during the dry season, we generally encourage persons to try composting and other means of getting rid of that type of waste.
Yes, and in this particular season, I mean, like you rightly said, most persons are home now, and we have a number of people who, encounter respiratory issues, asthmatics and so on. And now is really not a good time to be burning because you have the majority of people at home, and then you have the smoke disturbance, and of course, making their situation worse. So it is something that we will not give permission to do, and of course, there's also a charge, that can be laid on someone found guilty of setting fires in a residential area.
Okay. We'll take another break. When we come back, we want to discuss, because we have to do another changeover, we're going to talk about the curfew period, your responses, because you have other calls that are coming in for emergency assistance during this COVID period. Stay with us. A very quick break. We'll come back.
With all that's happening around us, simple adjustments are necessary to keep us all safe. When calling 911, we may need a little more information to deploy the right personnel and protocols. You may be asked about your travel history, signs and symptoms, contact and movement history, and whether others in your household are exhibiting similar symptoms. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
So are you saying do the change? Okay, thank you. You were just having a side conversation. But I talk about the emergency calls, the other emergency calls that are coming through, in terms of being able to respond to your COVID as well as the other incidents that we have around the place.
Okay, because of the partial lockdown or shutdown, the number of emergencies, medical emergencies have dropped. However, in those emergency calls that we do respond to, most of which are usually motor vehicle collisions, motor vehicle accidents, we've seen the severity of the injuries. There's an increase in the severity of those injuries. What we have observed as well is that although we cannot conclusively say, but alcohol is a great factor in those accidents. So we have been successful in responding to those calls with all of our resources. However, there is another key factor that impedes our ability to perform when we get to those scenes. Most times, our officers get to the scene of those accidents, there's severe crowding by members of the public. Some of the officers have even been threatened in terms of their approach to those victims. It poses us a challenge to us, as we cannot operate in those kinds of environments. So we need members of the public to be understanding. We advocate social distancing, however, persons are on top of our officers trying to perform their duties. So on a few occasions, we have actually had to pull back our officers from those responses, because the members of the public pose a danger to them, a physical danger, and the unseen COVID danger as well.
All right, so definitely a dicey time there. All
yes,
right.
but just to add to that, and talking about the curfew period, yes, we've had a reduction in the number of accidents and so on. However, we must know that the driving practices, exercise at that time sometimes leaves a lot to be desired. And I can speak from a personal experience where a goods vehicle, the driver of a goods vehicle, was driving on the extreme right. On the extreme right. I mean, I had to pull off the side of the road. At that point, some persons believe that they are the only ones on the road because,
road is
the
clear.
curfew. Yes.
Be reckless.
And I think, we need to exercise a little more control and safety on the roads, notwithstanding the curfew period being on.
Right. All right, so we will do our switch over, and when we come back, we have Station Officer Arlene Rosary, who will be joining Primus Hutchinson. So just stay right where you are, and we'll be back with Primus and Station Officer Rosary.
Rosary.
At war with a virus, ready to harm us. Panic is not the answer. We can win this together.
Often use hand sanitizer, better yet use soap and water.
We must protect each other if we are to beat this corona. Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are up. No.
Advice, give you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. St. Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Ok, merci Lisa, merci madame. Compagnie Kawe, nous avons une discussion ici avec les officiers pompiers, cette ici, qui a parlé sur la qualité des marches, qui a demandé d'adresser la situation ici, particulièrement avant la maladie corona. Nous avons un officier, station officer au Gaquier, ça c'est Adam Rosary, qui a parlé de nous à Coyol, et aussi chef pompier, département pompier, c'est ici, c'est Joseph. Je me dis, monsieur Rosary, bienvenue à cette discussion ici, à Etienne, et dis-nous, nous sommes normalement les pompiers toujours à bas chaque situation secours pour adresser avec maladie corona qui a fait encore plus, qui a posé plus pesant sur ça. Dis-nous que ça qui est en place à présent pour agir puis situation normalement avec maladie corona. Comment la situation est là?
Bon après-midi, M. Primus. Bon après-midi pour les personnes ici aussi. Moi, je voulais dire que oui, travail les papiers, c'est un travail qui est très difficile. Ce n'est pas une situation qui est juste pour payer cette ici, mais pour les papiers qui travaillent au niveau de la terre. Expressement pour actuellement, nous, tant carrément là, côté, on cherche de nous, les papiers, nous n'y pour combattre des faits qui évoluent, sordi, invasés, et puis nous aussi n'y pour faire report des calls de secours pour ambulance pour nous pour nous combattre vermine corona. Ça c'est une situation qui est neuf pour la terre et qui est aussi neuf pour papier cette ici. Nous avons répondu pour beaucoup appel ambulance en cas pour monde qui malade et bien qu'à hospitaliser maladie corona. Pour actuellement nous n'y à peu près 12 personnes attachées et puis département pour aider en ligne ambulance qui évolué car corona.
Bon, situation après ça, moi apprends que l'année où il y a place nouveau, avant, les gens tombés malades, c'est vite accident ça y est, les téléphoner les papiers, il y a poste là presque immédiat, mais nous apprenons qu'à présent, il y a des questions en plus. Ça c'est celle, particulièrement pour la situation de corona. Est-ce que vous expliquez plus ça sur ça?
Oui, nous comprenons quand les papiers raison pour nous tous protéger quand nous cas ça des vermine corona c'est qui a pris la vie comme un monde au niveau de la terre et nous voulons public là même comprendre pour nous pompiers ça aider nous aussi ni pour try protéger comme nous et pour protéger comme nous c'est raison nous demander yo c'est question qui dernière fois yo peut-être tenu raison quitter pays et ben est-ce que vini en tout un pays tout de suite si yo peut-être qu'a toussé en chaille et toutes ces cas ça c'est information nous savent pour qui manière pour nous bien préparer comme nous pour venir pour assister yo à ces cas maladie ça.
Avant moi pour chef là à présent l'année secours les papiers pour réponse vitement est-ce que yo ka habillé normalement mané avant mais est-ce que votre qualité équipement hard pour protéger quoi yo est-ce que yo pour habiller différent à présent?
Oui, à présent parce que nous pas en temps normal il y a un teasing plus temps pour les propriétaires habillés en dedans hard qui peut protéger les yo répondre pour cas corona public là ni pour aussi comprendre que c'est pas un cas qu'on ces jours avant les tout bas était normal actuellement pour nous ça pour cas public là nous aussi ni pour premier pour cas qu'on nous
nous allons prendre une petite pause monsieur madame à présent et là nous vivons nous allons causer vite et puis chef le pompier c'est monsieur Joseph merci bien.
coronavirus or COVID-19 continues to be a health emergency across the world, Caribbean people are concerned.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. And don't discriminate cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this together. Yeah. We all got to work with each other. Yeah. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
Red Cross volunteers from across the Caribbean, working hard to fight discrimination. So if a person should feel ill, then they will contact the authorities without hesitation.
The most vulnerable are the elderly, but the truth is it can infect anybody. So what we need is solidarity. Everyone helping everyone like a family. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. Don't discriminate cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening.
People around the world facing this pandemic. Coronavirus have the whole world a panic. Now is not the time to be fearful, but to be careful, supportive and empathetic.
This is the state of the society. Some people full of fear and anxiety. Yo, a lot of fake news in the community. But what we need now is more love and unity. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. Don't discriminate cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this.
Merci autant et merci pour rester avec nous ici à GIS NTN. Côté nous, nous en sorte des commandes pour adresser la situation maladie coronaire. Nous les officiers pompiers ici et puis nous avons causé puis monsieur Allen Rosary et nous aussi chef le pompier monsieur Joseph. Témoin avant moi commencer à causer puis monsieur Joseph pour anti-apologie puisque nous tenons un problème technique côté pas bien tant moins parce que micro a été cabanoti tout à cala et vous savez ces bagages là yo quand il y a des problèmes de temps en temps nous pas ça faire j'ai dit ça et nous prendre apologie pour ça. Monsieur Joseph qui chef le pompier cette ici comment est-ce que SPCA pour qu'on chef les pompiers là il venu pour situation à présent on a plus de responsabilité parce que on est maladie corona et qu'on est pour faire réponse pour l'autre situation nous apprenons que la tenue à côté situation est maintenant petit fracassé pour les pompiers les nous une nouvelle association qui fait bon alors comment est qu'on chef au tenue pour embrasser toute situation ça à l'air Paul.
Merci, M. Premas. Well, situation ça c'est une qui neuf pour nous tous. Et puis pour le département nous avons fait connoper parce que ici travail nous pour nous faire réponse pour toutes ces appels à la zone pour toute emergency. So nous avons fait connoper et puis ça. Quand les vient pour nous-mêmes, quand nous tout déjà dit, nous pas connaître tout ça qui est about Vermina, so tout le monde concerné. So ça autant qui fait Babono, c'est juste nous qu'à try point qu'à nous, because là c'est ça, nous pas voulu qu'à faire nous répondre pour emergency la caillou et si yo même maintenant nous supposé qu'à faire plus mais pas plus mauvais so nous pas voulu mener vers maintenant la caillou so c'est nous qu'à prendre toute précaution qui possible pour faire
Mais comme chef, comment cette expérience là pour est-ce que ça métier c'était plus de tracassement, plus bas dans ça, ou ça accompli un normal, opération normale, et mettre plus bruit dans les hauts, comme chef.
Well, bagay là c'est ça. Ça sont nos pièces pas de SB, c'est un bagay qui a affecté whole la terre. So bagay là c'est ça. Travail en pompier, ce qui a changé toutes les. Nous habitués avec ces vieilles conditions, toutes bagailles. So, laisser bagaille ça, nous avons juste point un jour par jour. Pour moi, moi je veux travailler avec un membre comme moi, so nous avons fait ces réponses-là. Plus mais pour Jean Saint-Denis.
Ok. Monsieur Rosary, est-ce que ça a été l'occasion pour les pompiers de plus d'équipement comme ça a été avant? Est-ce que vous avez plus d'équipement? Est-ce que vous avez fait changement ambulance et comme ça pour bailler qualité service là à présent? Est-ce que ça a été nécessaire?
Oui, il était nécessaire pour nous de changer la manière dont nous fonctionner à un département les pompiers. Parce que nous avons besoin d'ambulance et pompiers spécifiquement pour répondre pour appel Corona. Nous aussi avons besoin d'équipement équipement pour protéger les pompiers eux-mêmes. Les gars aller dans place côté qui peut-être pas bien protégé pour santé lui-même. So ça aussi mettait en chai effort pour nous as un département ça répondre pour demande société.
Bon, nous apprenons qu'en ce temps ça nous savons quand même là avec quand même la cani on savent temps sec tout côté sec l'année en possibilité pour l'année du fait et nous apprenons que ces populations a trouvé quand en situation côté pour adresser ça et l'année c'était côté il est difficile qui ça qui a une cause c'est difficile à fait souvent.
Well, as a département nous comprenons que pour actuellement nous n'avons pas plus de monde qui actuellement la caillou parce que c'est normal. Et aussi c'est en temps ça c'est un farmer qui a profité pour préparer jardin yo, brûler terre pour commencer à planter. Moun aussi qui en caillou qui utilisé plus de temps pour nettoyer ou li won caillou faire ou li won caillou garder belle. Et tout ce là qui fait yo bon plaisir pour faire ces bails ça ou li won caillou. Ça nous veut dire pour le public là c'est pour yo comprendre que nous dans temps quand même qui bien mauvais l'eau pas en bagaille qui est available comme avant parce que nous pas qu'à ni pièce la pluie ces jours. So nous commander public là pour yo comprendre aussi et nous et pas commencer à faire ce qui pas nécessaire.
L'autre situation qui c'est pas un bagage qui est nouveau, c'est pas une situation qui est nouveau et puis les pompiers, mais il a venir mettre plus situation qui a venir plus sérieux, qui a venir concerner, puisque moi chef l'a dit ça en anglais tout à l'heure là. Les pompiers allaient à son situation secours accident, même public pas qu'à venir les pour conduire travail effectivement juste situation qui arrive côté c'est mon cas menacé c'est propriétaire. Est-ce que qu'est-ce que ça fait là-dedans puisque moi tant chef l'a dit délai yo kan pour tirer ces officiers parmi ces monde ça là mais est-ce que la santé puisque ce travail qui a fait ça c'est loi pays à protéger les pompiers les membres publics pas supposés yo savent pas supposé faire bail comme ça Est-ce que la pas une action, permission pour tout ces gens là, parce que si c'est la famille qui a un accident, c'est soit qui quitter les papiers fait travail, ou quitter mon peut passer.
Moi juste dire un petit parole là ça. On cherche les gens assemblés. Bon c'est ça. On cherche les ils voulaient aider. D'autres gens veulent aider. D'autres gens viennent juste garder, mais d'autres gens veulent aider. Mais on cherche les situations ça on parle about qu'a fait avant police là arrivé.
OK.
Because police là n'est pour faire crowd control. Oui, là ils viennent associer ça.
D'accord.
Mais ça nous a dit en ces situations ça especially à présent et en temps Covid il really pas bon because vous avez dans danger en ligne danger tout le monde ensemble par là c'est ça il a délai empêcher nous même l'air pour faire travail nous so si l'année on cherche monde en laissant nous avons demandé ou assistance si nous besoin mais on est pour chaîne bon tu distance.
OK. Et quand qui te dit là les Adam moun pas comprendre ça ça tout la situation côté les populations trouver quoi côté membre public là qui menacé yo ça sont pas qui sérieux.
Oui ça sont pas qui sérieux nous même qu'à point ça bien sérieux so n'importe situation comme ça nous espérer n'importe monde qui est responsable quand toi peut arrêter et ça fait temps l'argent pour ça.
OK. Monsieur Rosary, station officer, c'est pour station les pompiers et chef officier. Dernier morceau de parole vous autres chaque qui qualité de conseil on est pour public là généralement sur travail là autres café à présent.
Nous voulons dire à ce département les pompiers actuellement c'est quand nous avons dit plus bonheur c'est pas tant normal travail les pompiers a venu en chaque plus difficile parce que c'était avant nous comprenons que nous ni pour aider peuple public là en tant les bagages mauvais tant soukou tant corona tant diffé aussi et nous pas ni en grande quantité de monde qui travaille dans le département. So nous voulons dire public là pour aider nous, aider eux. Si nous ni moins qu'à côté nous ni pour répondre pour les secours qui nous ça nous pas obligé ni pour faire. Try pour c'est pour yo comprendre pour si yo ça aider nous aider yo en ces cas ça il y a un chai primaire pour conduire ces ressources là qui est available pour le département quand nous dit diffé on chai c'est diffé nous SPSC ces jours il y a pas diffé qui nécessaire là ni l'autre manière nous ça préparer terre nettoyer au limon kay nous plutôt qu'à mettre diffé en wagé c'est diffé wagé ça aussi qu'a compliquer situation en maladie respiration et corona c'est aussi en maladie respiration so pour empêcher public là qu'a crié un cas côté yo peut-être que adam moun ni malade vermine corona de c'est juste malade parce qu'il yo te ni la fumée au limon caillou. So toutes ces bagages ça si moun tient ça en l'idée yo moi de travail nous kay on chay plié.
Dernier petit morceau parole chef.
OK well merci encore monsieur Primus. Well nous savons situation ça c'est pas yon qui bon pour personne. Mais nous ka pour dire bon pour pas dire oui trop. So pas de temps nous ka opérer en ces situations ça département qui fait coïnpé pour primaire service là nous ça but nous voulons point on démarche et suivre ces guidelines là c'est les autorités à mettre en place pour chaîne corps ça.
Merci autant chef le propriétaire ici M. Joseph et aussi officier pour station le pompier Allen Rosary pour causer pour nous accueillir. À présent, je vais pour collègue moi là, Lisa Joseph. Okay, Lisa, you mean?
Yes, thank you so much, Primus. Merci pour ça, Primus.
Oh, why? You're improving, eh?
Yes, I am improving. Being with you, I have no other choice but improve.
Oh, boy.
So I do want to just, we have a minute to wrap up, and I want to be able to give you at least 50 seconds of that, the Fire Chief, in order for you to be able to give us your final words in English.
Thank you very much, Lisa. I must admit that notwithstanding the pressures that we are under, there's still some good to report. First of all, we've had no cross-contamination within the department, so that's something good to speak of. We've responded to calls involving positive cases, and there's been no cross-contamination. We have not run out of PPE, thankfully, and quite apart from what's being provided by the Ministry of Health and within our own resources, we have gotten some donations that we are very thankful for. We intend to have to say a big thank you eventually, and of course we'll have all those persons mentioned. In addition, there are quite a number of companies that have volunteered to provide assistance where necessary, and we are quite grateful. So before I close, let me just ask members of the public to adhere to the guidelines set by the authorities. I think it's for our own good and our own safety. It is not a comfortable situation to be in. Yes, it's not something that we brought on ourselves, but it is something that we can get out of if we take the appropriate steps.
Thank you so much there, and absolutely.
Let me just
fine. Yes.
I read on a poignant point that one of your esteemed chief passed on recently.
Oh, yes.
I think you all should.
Indeed. Thank you very much, Mr. Primus. Actually, it was one of the first things I intended to do. Yes, Mr. Primus Duplessis, who was our former chief. I think he retired in 95 or thereabout because Mr. Gasper became, yes. He passed away earlier this week. And well, of course, the St. Lucia Fire Services mourning is lost, and we, of course, extend condolences to his family. We think that Mr. Primus is deserving of a good send-off. However, because of this corona season, we are unable to do that. But in whatever way we can, we will provide support. And I think St. Lucia should be happy for the great service that they provided.
Absolutely. Thank you so much for that, Fire Chief Joseph. We've been speaking there with representatives of the St. Lucia Fire Service as St. Lucia responds to COVID-19. That response continues. We have another update immediately for you from the Ministry of Health and Wellness. So stay tuned. That's coming up right after our goodbyes. I am Melissa Joseph alongside Primus Hutchinson, thanking you so much for watching.